Away here we go. So, good morning, guys. Again.
Morning.
So,
Good morning.
Good morning.
are you still needing some caffeine and some waking up?
Morning.
Morning. So last night's class, the night class asked me about going to the classroom soon, and that's a possibility. That's something that we have to talk about at the school, the administrative level, because even though the state is loosening up some restrictions, we're not sure if the county's going to loosen up those restrictions. Plus, we're still worried about your guys' safety. Now, we do have gloves, we do have sanitizer there, we do sanitize, we do clean stuff. We would have to follow social distancing, and with a class of like 28, that might be a little difficult because you guys would be in close proximity. So that's something to take into consideration. Plus, it's also your guys' input. Do you guys want to be cooped up in a room right now, or you still want to keep social distancing? Because we are following social distancing at the office. What's your thought?
Good morning.
Morning. Thoughts?
What was it about the social distancing?
Well, the night class asked me about starting in the classroom soon, because the state of Texas is starting to loosen up some restrictions. And the thought is that the county's not going to loosen up a lot of restrictions. So, and the discussion is letting you guys be in there. We do sanitize. We do have sanitizer. We do wipe down surfaces. We do follow social distancing. The only hiccup we have is there's so many of you guys, it's going to be hard to keep that 6 feet of separation. So we want to take your guys' safety into account. So what are your thoughts on social distancing in there in the classroom?
I mean, I would show up. I'd rather be in a class. You know what I mean?
Okay.
I mean, we'll
Like, I
we'll
wouldn't
worry
mind
about the
the class
safety
there,
more, like gloves and masks too. So it wouldn't be a problem.
Well, we have gloves, masks. We've ordered them. We're just waiting for them to come in, as a lot of other agencies are waiting. Was
But
it
can you
used to
just
call you or say something?
I was just saying that I wouldn't mind going to the classroom. It's just that like sometimes we don't know if we're actually carrying the coronavirus because if we're going places, and then with the big
Correct.
large group, it's going to be harder to maintain it too.
Yeah, and one thing that we would do is we would monitor you. In other words, we'll take your temperature every single day, and if you have fever, you're going to be sent home.
Keep it as is.
Yeah, our main concern is your guys' well-being. We don't want to jeopardize anybody just to get in the classroom. We could always adjust the schedule if need be to accommodate what's going on. It's really beyond our control. We have plans. Like I told every one of you, things are changing daily. And so we don't know what's going to be done tomorrow. We really don't know what's going to be done today. Although I heard there's somebody's having a meeting next week. I forget if it's city council or the commissioner's court, but there's a meeting next week, like next Monday, to go over some more stuff.
It's city council.
What was that?
It's city council. I work for the city. They were talking about that.
Okay. So see, between now and then, maybe nothing changes, but next week, who knows what they decide to do. So I just wanted to, in case you guys were wondering, I just wanted to bring it up to let you guys know. And also to get your input. So when I talk about it with my boss, with administration, I'm representing you guys as well. It's not, we don't want to rush it and get you guys in class just so, we get back into the atmosphere. We want to make sure that everybody's protected. We're helping to flatten that curve and do what we can. So.
I'm okay.
So there was, yeah, and it seems to be some are okay, some aren't. I know my advanced class, it's the same thing. Some of them are okay, some of them aren't. I had one of my advanced students actually transport a COVID patient last night to a residence where the family also has COVID. And so he's like, "You want me to show up today?" I'm like, "No." Even though he took proper PPE precautions, it's better just to not risk it. I mean, the risk is low. Utilizing the proper PPE is going to help you. But somebody finds out, they're going to start freaking out, and I'd rather not hysteria in the class. So, all righty. It seems like both, or I'm imagining or something, but it sounds like somebody needs to change their smoke detector. Not everybody's here. So, Ashley, does that mean you're our inside person with the city?
I will try and get as much information as I can for you guys. As far as I know right now, because I do work
That's
for
cool.
aquatics, we're not opening any of the pools back up for the summer.
Yeah.
They're gonna all remain closed. Even to us, they're telling us like not to get in the water when we do go. And then they've been having us patrol parks and kick people out for the last 2 weeks.
See, damn, people don't listen.
Yeah, one of my coworkers was there the other day, and this lady tried to get violent with her. It was pretty intense.
Oh, dang. Yeah, I drive around, like going to the school, and I see all these people, and even on the freeway sometimes, it's like there's a lot of traffic. I'm like, there can't be that many essential people out there.
I say that
Who
every day when I
knows?
go to work.
Or you're like, I'm not essential, or hi, I'm essential.
Pretty much.
I'm supposed to be working from home, although I am right now. Although I'm gonna go in my man cave. I like going into my man cave. I like the view. But no, I've been going into the office. So I'm going back after I'm done here. I'm gonna head over there and get some stuff done and work on your guys' grades. It's like it never fails. I'm in the office and people start showing up to see me. All righty. So the human body. Are you guys ready? Are you guys excited?
I'm ready.
Yes.
Oh, I could hear the enthusiasm. It's awesome. So the human body, it is a fascinating structure. And actually, this is what I'm going to do. I did give you guys a PowerPoint. However, sorry, phlegm. I did post up the PowerPoint the other day or yesterday, but I'm going to also show it on here because there's a lot of diagrams. There's a lot of pictures that I really want to show you guys and really make it come alive. I will try and draw on my little whiteboard as much as I can, but we do have the PowerPoint, so I'm going to go off that as well. Okay. So here I'm sharing my PowerPoint screen with you. All right. So we did the intro stuff where we were at, where we've been, where we're going. We talked about the legal, ethical, medical stuff. Talked a little bit about terminology with communication. We talked about documentation. So that's just setting it up. Now we move on into kind of what we want to know, and that's the human body and how to take care of it. The human body is a very fascinating structure. Like I said, it can get very complex, but there's times where it's very easy. You just have to think about what's going on. For example, the respiratory system. What is it doing? We're breathing to get oxygen in and to get rid of carbon dioxide. It's pretty simple. But as we start going a little bit deeper into it and the physiology, how it works, it's fascinating. And I'm trying to remember, did we? No, we didn't. That was the advanced class. We'll talk about what's happening with the changes in pressure, with getting air in, with an active process to cause changes in pressure to let the oxygen in, and then for the carbon dioxide to go out. The heart, the way the blood circulates, it goes round and round. So this is where we start getting into that. Now, in education, we have laws. Oh, okay, who took control of my screen? All right, got it back. With the laws of learning, there's one called the law of association. And the law of association says that you learn better when you associate things with things you already know. And so I'm going to show you some tricks. Now, those worked for me because I was able to relate those to stuff I already knew. So it doesn't necessarily mean that that's going to work for you. It's something that you can associate to remember those terms. Okay. So we're going to talk about anatomical terms. We're going to talk about the body systems, and we're going to talk about some medical terminology. Now, this will take 2 days because I'm used to taking 2 days with the lectures for chapter 7. Okay. So, you guys ready?
Yeah.
Yep.
All right.
Yes.
Yes.
All right. So, case study introduction. So, EMTs Andrew and Brandon have just arrived on the scene of a patient with multiple stab wounds. Law enforcement has secured the scene, allowing Andrew and Brandon to approach the patient, who's a man in his 20s. Andrew notices immediately that the patient appears to be unresponsive with pale skin. So as we start reading that, he has stab wounds, he's unresponsive and pale skin. What happens is the body is going to start making changes to try to take care of itself. And pale skin is one of those. So right away from experience, I'm telling you, and from knowledge that you guys are going to get, is that he's probably bleeding internally. He's losing blood. His shirt and the upper portion of his pants are saturated with blood. See what I mean? And blood has started to pool on the floor around the patient. So he's bleeding out. Did I tell you the good news and bad news about bleeding yesterday?
I don't recall.
It can be stopped.
Kind of, sort of. The good news
It
about
always
bleeding
stops.
is that, yeah, the good news about bleeding is that all bleeding eventually stops. The bad news about bleeding is that all bleeding eventually stops. So that is quite interesting. So just know there's so much blood in the body, and it takes a while to replenish it. So we might have to do something to help replenish that blood. All right. Brandon reports that the patient has a weak carotid pulse and begins managing the patient's airway and ventilation. Cutting away the patient's clothing to determine where he has been stabbed, Andrew sees 2 stab wounds to the left side of the chest, a stab wound to the upper right abdomen, and a stab wound to the right groin, and several cuts on the forearms and hands. So the left side of the chest, can those be critical stab wounds?
Yes.
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 Yeah.
A stab wound to the right upper abdomen, can that be bad?
Yeah.
And
Yes.
we'll discuss why the upper right abdomen can be bad. A stab wound to the right groin, ow. For you guys, you should be going ow.
Yeah.
I mean, if it was the left side of the groin, then you have main arteries right on that side.
Well, you do on the right side as well. You got the femoral artery on either side.
It's just the groin in general.
Yeah, it's a delicate area. You're like, whoosh, they missed,
Yeah.
or hopefully they missed. So several cuts there. So what organs may have been injured by the stab wounds, and I don't expect you guys to know. We'll go over it. But any idea right off the bat?
The liver.
On the
The
right
liver,
upper
excellent.
portion, you could get the pancreas, the small intestines, the gallbladder, the kidney.
Well, the kidneys in the back. The main one we're worried about in the right upper abdomen is the liver. What about other injuries? What other organs?
Your lungs.
Lung. Okay, good.
Arteries.
Okay, like femoral artery, good. There's one big one that's left.
But the heart?
Mm-hmm. Yep. That left side of the chest, the stab
The
wounds,
heart.
would be worried about the heart. A friend of mine, her sister's boyfriend, it was right around Christmas. They were walking somewhere and this guy was abusing his girlfriend. So he went in and tried to stop it. The guy took out a knife, stabbed him in the chest and killed him. Punctured the heart. What are the consequences of injury to each of those organs?
Like the lung and the liver are mostly fatal wounds.
Why?
Compressed lung fluid, respiratory difficulties.
Okay. Oxygenation. Okay, good. What else?
Well, because it's the heart.
Okay.
Cardiac
Well, why is
arrest.
the heart so important? Okay. Cardiac arrest. Well, why is the heart so important? So you
Because
can
if he's bleeding out,
rehab
it's
after?
pumping blood, so he's gonna bleed out faster. So
Well,
it's like less time.
yeah, but no, the main thing is those organs deal with a lot of blood, so the person can bleed out.
They also carry oxygen into your brain,
Yeah.
everywhere else.
Good. Yeah. Um, what we're going to start learning is that there's several organs that the body needs to take care of right away. The number one organ it has to take care of is the brain. Number two organ is the heart. So the body's going to do what it can to take care of itself. That's the important thing. It's going to start communicating and saying, hey, guys, I need help here. Send some help. Or I need help there. Let's take care of that. So the body's going to do what it can to take care of itself. So yes, the brain and the heart are the first two organs that the body has to take care of. Now, remember that the brain can live without the heart. I'm sorry, the heart can live without the brain, but the can't live without the heart. So that's why we make stupid mistakes with relationships. Because even though the brain is telling us, no, don't do it, the heart's like, oh, screw you, I'm doing it anyway. That was heartbreak, right? Okay. Somebody's awake. So we need to learn about the human body. That is the basis for everything that we do. And remember I was telling you guys about the language of medicine? We have to learn that language. And there is a trick to it. First off, if you speak Spanish or understand Spanish, that's going to help because a lot of the words are based out of Latin, are based in Latin. So Spanish is a Latin, well, it's a Romance language, but with Spanish, it does help. Okay. Now, as far as the initial body position, where we start out from, and this is the very first thing everybody learns that's learning anatomy and physiology, is the anatomical position. Everything is based off of the anatomical position, which is basically just standing tall, facing forward with your palms out, arms to the side. So that's the anatomical position. So when they say, I know stuff like the back of my hand, they're not talking about this part right here. They're talking about this part right here. And so later on, when we start learning about anterior posterior, this is your anterior hand, or actually this is the palmar surface of your hand. And this is the posterior part of your hand, the back. Now, positions of the body. So we start off with the anatomical position. Okay. Everything is based off the anatomical position. Now, the first position they're talking about is supine. And so if I could find I can't see it. Darn it. So the first position is what we call the supine position. And supine, all it is the person's laying on their back. That's it. The person is laying on their back. The next one is prone. And prone is laying on their stomach. So they're supine, real easy. They're laying on their back. Prone, you notice how they're face down?
Yeah.
Yeah.
Now, the way that I remembered prone, and again, this is what worked for me, might not work for you, but I'm not speaking from personal experience for the record. I think of prone as being prone to attack from the back. In other words, don't drop your soap.
Something we don't need to know.
Prone. What?
Nothing.
What was it, Sequoia?
This is something we don't need to know.
Now I won't forget.
Something we don't do.
That we don't need to know.
Oh, true. But it's something to help you remember. It just, so in a PG version or even a G version or PG, because it deals with violence, you don't want to turn your back to anybody because they could stab you in the back. So that's why I'm saying you're prone to attack. So again, that's what we're doing.
No. Yeah.
The other position we have is a lateral recumbent position. Lateral means to the side, and recumbent is laying down. Okay. Now this one is called right lateral recumbent because the patient is laying on their right side. We could also put them on the left side, and in that case, what would we call that position?
The left lateral.
Good. It would be the left lateral recumbent position. All right. So there's the left lateral. And both of these are also known as the recovery position. That's something they teach you in CPR. The recovery position.
Yes.
Yes.
Okay. And why is this position helpful? Either on left or right lateral recumbent.
To release pressure.
Monitor the airway.
The main thing is later on we're going to learn about the left lateral recumbent and relieving pressure where, but the main thing is that it helps maintain an open airway. So the person vomits, it could drain out of their mouth. So next time you're at a party, once the restrictions are gone and you party it up and somebody's been drinking too much, they pass out because you know what's going on, you're going to put them in the lateral recumbent so they don't choke on their vomit.
But it's always on the left side, right? Not on the right side.
No, it could be either side. The main thing is do it in a way that you could monitor them. In other words, if you put them on the right and you're on the other side, all you're checking is their backside. So you're not really monitoring that patient. So put them in the position that you could see their face. Okay. All right, the next position is called the Fowler's position. And the way to remember Fowler's is they're sitting up. Now there's several Fowler's positions. The most common one that we use is about 45-degree angle. Just basically comfortable. You could lower the back of the gurney a little bit more if they want to fall asleep. It's easier when they're laying down a little bit more than when they're sitting up. And also have what they call a high Fowler's position, where they're at about a 90-degree angle. So she's pretty close to a high Fowler's. So the Fowler's position is they're sitting. Okay. So far, so good?
Yeah, so far, so
Yes.
good.
Yeah.
Yeah.
Okay. Now the other one that we have, we used to have what they call the Trendelenburg position, which is pretty similar. But the difference between shock position is a Trendelenburg, but now we don't necessarily elevate the legs like we used to do with Trendelenburg. Now on the gurney, there's nothing else we can do. We just lift the feet and it locks, and there's no in between. But a true Trendelenburg is the legs are elevated 8 to 12 inches above the heart. And then the bottom part of the body is kind of at a downward angle. And that's to bring blood back from the extremities into the core where it's needed. So that's why we utilize the shock position, okay? Okay, so one of the things that we can do, and I need to get out of my man cave real quick so you guys can actually see. Okay, I put a couple little drawings here. That first one right there, they're standing up. You could say that's anatomical position, but if we happen to draw that on paperwork, means that they were standing. The next one, you can tell whether up or down, but what position would you call that? This one right here.
The Fowler.
Supine.
No, it's the supine. That one would be the Fowlers,
No.
or what we call actually semi-Fowlers. True Fowlers would be that one right there. Okay. What do you think that position is?
The shock
There's a head.
position?
That's the shock. And what's that one?
Sitting.
Yep, just regular old sitting. Where you would do those three at the bottom is what we would use when we have when we're taking orthostatic vitals. It's vital sign that we use when we suspect the person to be dehydrated. So simple times. All right. Any questions on the positions?
No, sir.
Excuse me. All right, so let's see. Lying in a face down position, which one is it?
Pro.
Prone.
Okay. Lifting the arm out to the side away from the body. Oh, we didn't cover that yet.
Abduction.
Abduction.
Yeah. When it's away, you abduct it. When you bring it in or add it to the body, then that's adduction because you're adding it to the body. Yep. Lying on the side.
Lateral.
Lateral recumbent.
Recovery or lateral.
The lateral one.
The last one, bending an extremity towards the body.
Flexion.
Flux.
Flexion.
Can you call it the fetal position too?
What was that?
Can you call it the fetal position or no?
No. One of the things about flexion, the way I use to remember is when you flex, right? You're doing that. So you're showing off, right? But what you're doing with flexion is you're decreasing the angle. So here's the angle. You got this. Whereas extension, you're extending it out. Flexion, you're decreasing the angle. Extension, you're extending it. Does that make sense?
Yeah.
Okay. We're getting serenaded. All right. So anatomical planes. The anatomical planes are imaginary divisions, lines that break the body up into different parts, different topographical areas. So we have the sagittal and the mid-sagittal plane. We have the frontal and coronal, transverse or horizontal, the midline, mid-axillary line, and the transverse. So the frontal or the coronal plate runs to the middle, but it's dividing the body into front and back, or also known as anterior and posterior. And so just think about being little and they talked about your posterior, or you talked about your posterior, your backside. One way to remember posterior, back. Anterior, again, I was talking about Spanish, antes. Although, so the anterior is the front part. The sagittal plane, also known as the median plane, that also goes down the body in the center, but that separates the body into left and right. Now, when we're talking about left and right, always remember we're going to be talking about the patient's left or right. So as we're seeing this picture, this side here is our left side, correct?
Yes.
Okay. Now, when we're referring to an injury, let's say this patient got an injury to their right forearm. Which forearm did she injure? This one? Are you guys able to see my cursor?
No.
Yeah. Wait, what question?
My arrow.
No, I can't.
No, I can't either. No. But I'm assuming the left side of the page is her right side.
Yep. Let me do something else then. All right. Do you guys ever see my screen yet? All right, so now you
No,
can
I
see my cursor. So here's my laser pointer. So I said the patient had an injury to the right forearm. Is it this one?
Yes. No.
No, no, that's the left. That's the left.
Your
Yeah,
right, your
remember
patient's left.
Yeah, it's al revés.
Remember when we're talking about right or left, we're talking about the patient's right or left. So you know, as we're looking at, this is left and right. We're referring to the patients. So this is your right, or the patient's right. Oops, a little bit too much. Got carried away with my pen. Okay. All right. So basically, I was saying if an injury is right here, and we say the right forearm, because we're talking about the patient left or right, the injury is right here. You see that? See my red dot over here in the upper right corner?
I only see LO on my screen.
See what?
LO on my screen.
LO.
Yeah, for Luis Ortiz. There you go. Nice, yeah.
Mine takes a while to load, but it's getting there.
Okay. All right. Now, earlier, we talked about dividing the body up into left and right. So the coronal plane or the frontal plane, we have the sagittal plane. So here's the midline. And so it divides the body into right and left. This line here, the mid axillary, goes straight through the middle of the axilla. And that separates into anterior and posterior. Now, as far as directions, starting out with, let me get my little marker. The first one we're talking about is proximal and distal. I want you guys to remember about proximal and distal is, let's refer to it to the point of attachment, okay? Although that's not going to matter much. What I mean with the point of attachment, we're talking about proximal and distal. First off, when I think about proximal, I think about proximity. And what does proximity mean?
The distance between something.
No. Okay, but somebody else was saying something.
The distance between something.
How close you are to something?
Okay, think about closeness, proximity. So some what?
Would it be like near?
Yeah. So when I think about proximal, I think about being close to the point of attachment. So in other words, we have the arm. Okay. This part here, forget this whole thing being your arm or this being your arm. Your arm now is just the humerus part. That's your arm. So the point of attachment for the humerus is the shoulder. So this part right here is proximal humerus. Same thing with your forearm. Here's your forearm now. So close to the point of attachment is the elbow. So this part of your elbow, this where my hand is, that's called your proximal forearm. Now, distal, I think about distance. So further away from the point of attachment. So if this was proximal, what's this area here?
The closest.
No. Here's the closest. Here's my proximal forearm. And I just said distal, think about distance, so further away. So what part is this of my forearm? Look at my camera, since I'm the only one with the camera on. Mhm.
Distal.
There you go. It's my distal forearm. And so proximal and distal, in this middle part, what do you think it's called?
Which middle part?
Middle part of my forearm. So, like I said, this is proximal and this is distal. So this middle part, what do you think it's called?
Medial.
Medial. It's my medial forearm. Somebody heard the dog barking, so she woke up and started barking. Okay. So proximal, medial, and distal.
What did you say where the hip is at? Like it's the video is freezing. So what did you say like around the hip area? Yeah.
Well, the hip is the hip. What I've been saying is you got to think about the point of attachment when you're referencing proximal, medial, and distal. So, like the lower extremity, that's what we call the legs also. Upper extremities and lower extremities. So lower extremities would be legs. And we break it down to the hip, thigh, the knee, the leg or the lower leg, the ankle, the foot. So for the hip is a point of attachment. So we start going down on the thigh. that first part is the proximal thigh. Whereas further away from that, near the knee, that's the distal thigh. And in between the middle is the medial thigh.
Kind of get it. Yeah.
Okay. Now the other thing is the medial and lateral aspect. When we're talking about medial, we're talking about towards the midline. You see the midline goes right through here. You see the medial line right here. So anything toward the midline is considered medial. Anything away from the midline is considered lateral. So the way that I remember it is towards the middle is the median aspect. And then away from the medial line, in football, when you throw a pass to the side to like your running back, what is that called? Or you chuck it to the side. No football fans in here? Cool, so I can talk shit
Lateral
about the
pass.
Cowboys.
A lateral
Nobody's
pass.
gonna care. Oh man, you're gonna make me not say shit about Cowboys. It's lateral, a lateral pass, so off to the side, right? So that's exactly to think about for the outer part, off to the side. So that would be that would be lateral. You see here, medial and lateral. But usually talk about these aspects, the medial aspect, the lateral aspect. Okay. Same thing here. What aspect is that I just drew?
Lateral.
The lateral.
And how about that aspect?
Lateral.
No, right here.
Medial.
Medial.
Medial. Shit, I'm not done with this one. Okay. The other term, or another term, is superior versus inferior. Superior, we're basically talking about toward the top. That's superior. My O's always look funky. So towards the top, superior. Under or below is inferior. Okay. So you see here, superior towards the top, inferior down or below, towards the bottom. So here's the mid-axillary line, because again, why?
Because it's on the armpit, which just crosses the middle.
Yeah, it goes down the center of the armpit. Another line to know is the mid-clavicular line. So right up in here, your collarbones, those are called clavicles. And so down the middle, where the clavicle is, when you go down the middle, It goes, although I missed it, but it goes right over the nipple. Okay. You need to know with those mid-clavicular lines, so the line that goes down the center of the clavicles. That's why it's mid-clavicular, pertaining to the clavicles. Any type of injury in this area in here, oftentimes fatal, because what do you have in that area?
Your lungs.
Mm-hmm.
Your diaphragm.
Okay.
Your lungs, your heart.
One more.
Your spleen and gallbladder.
Nope.
Like above the collarbones, or
Mm-mm.
no?
It should be the liver.
Part of it, but there's one more big structures that I'm worried about.
Would it be your thorax?
But what in the thorax?
Your rib cage.
Nope. Nope. The ribs will heal. What we're worried about is the great vessels of the thorax. So the aorta, the thoracic aorta, the abdominal aorta. Okay. And then earlier you heard me using the term plantar or palmar. So think about the palm of your hand. Palm of your hand. Plantar. Again, Spanish, las plantas de los pies. So the underside of the foot, that's the plantar surface. Anybody have plantar fasciitis? That's where the ligaments in the bottom of your feet are really stretched out and your feet really hurt. So plantar.
Like if your foot's straight. You look in
Well,
an arch.
it should normally be straight. So I didn't understand the question.
Yeah, never mind about that.
Okay. All right, regions of the body. As far as regions, it's kind of like the United States has different regions, the New England states, Appalachian states, the East Coast, the Pacific Northwest, the Southwest, Southeast, Ohio Valley, that kind of stuff, the plains. Well, the body does too. We have the head, we have the torso or the trunk, we have the lower extremities, and we have the upper extremities. Okay. As far as the head, we have the skull and the face, the torso. The torso is, or the trunk is the chest, the back. Then further, we have the cervical region pertaining to the upper part of the back. We have the thoracic region, middle of the back. And we have the lumbar region, that's lower back. We have the hip, we have the pelvis, we have the lower extremities, and then upper extremities. as far as the lower extremity, like I said, you have the thigh, the lower leg, or the leg itself. I mean, you can call it lower leg, you can call it leg. But this whole thing's not your leg anymore. It's lower extremity consisting of the thigh, the knee, the leg, the ankle, the foot. Okay. Upper extremity, same thing. We have the shoulder, the arm, the forearm, the wrist, the hand, and the fingers. In this area in here, at the fold, is called the antecubital fossa. Yeah. Head, thoracic, lumbar, umbilical area, where your umbilicus, your umbilical cord was. The general area. Questions? I don't know if that's a good thing or a bad thing.
No, I'm thinking about it, but no, I don't have any questions.
Okay.
Makes pretty much sense.
Yeah, because you guys are just really quiet, and I don't know if you're sleeping. I don't know if your minds are alone. I don't know what's going on. I want to make sure you guys are. What was that?
I'm drinking coffee.
Okay. I'm drinking my Monster.
I'm just listening.
Okay. Here's the diagram of the anterior chest. So remember that midclavicular line. On the other side, you see the lungs right there. Your heart's going to be here, the great vessels. Over to the side, off the midclavicular line, is most of the liver, although some of it is found in there. There's a little tip, the xiphoid process. Here's your sternum, your breastbone, your clavicles, or your collarbone. It's called clavicles. Here's your ribs, and there's muscles in between the ribs, and those are going to come into play in a short bit. All right. Knowing the area of the body and what structures, what bones are there, will help us reference more or less. Because if the patient suffered an injury to the left lower extremity, how big is that left lower extremity? Pretty big.
Yeah, pretty big.
Now you say the patient suffered an injury to the left lower leg on the medial aspect. That make it better, easier to identify.
Yes.
Yeah, it does.
Yeah.
Okay. There's a lot of topographic anatomy, isn't there?
Yes.
The cranium, the
There is.
TMJ, the clavicle, the humerus, the radius, the ulnar, the radius and ulnar, the greater and lesser trochanter, pubis, femur, patella, tibia, fibula, or tibia and fibula, the malleolus. Oh, it's so fascinating. The body also has cavities, or areas where certain organs go. So the first one is the cranial cavity, the spinal cavity. So what do you think fits in the cranial and spinal cavity?
The brain.
Was that?
The brain.
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 Then spinal cavity.
Spinal cord.
Spinal cord. Now, the thoracic cavity. What do you think we have?
The lungs.
The lungs.
Your ribs.
Lungs. Okay. But no, the ribs are not within the cavity itself.
Oh,
It's
yeah, lungs. Yeah.
Ribs will enclose it. Now, the border between the thoracic cavity and the abdominal pelvic cavity is diaphragms. Anything below the diaphragm is considered to be abdominal in nature. Then we have the abdominal cavity, which they combine it with the pelvic cavity. So you have the so you have the abdominal cavity along with the pelvic cavity. So you have all the intestines, the stomach, the liver, and then pelvic cavity. You have the reproductive organs, and you have the bladder. So all of that is put together, but that's below the level of the diaphragm. Okay. Now, keep this picture in your mind. The abdomen. If I tell you you're driving for Uber, and I tell you take me to the Far East, is the Far East pretty big?
Yeah.
Yes.
It is, right? So how are you going to know more or less which area?
East is.
Like getting specifically directions.
Yeah.
Okay. So a little bit more or a little bit more localized directions. Okay. High schools, you kind of know the area by the high schools. Americas is down over here off the loop in on Pelicano. You have Del Valle, which is down Lower Valley. You have East Lake, way east of here. Mountain View is over in Montana Vista, right? El Dorado. So getting a bigger area really does help. So also knowing, do you think if you drive a taxi or Uber, or even driving an ambulance or a police car or fire engine, isn't it good to know your area?
Yes.
Yes.
Yeah.
So they say, "Oh, take me to the Walmart over in the Northeast," or I'm sorry, not Northeast, in the Far East, and it's just east of the loop. Well, how many Walmarts are there just east of the loop?
Like 2 or 3.
Just east of the loop?
East of the loop.
Yeah.
There's 2.
Okay, there's one in Montana. Which other one? There isn't.
No.
They have a neighborhood one off of Zaragoza in Edgemere.
Yeah, but that's a little bit off the beaten path. So the regions. So we'll talk about the abdominal quadrants. So first off, we have the belly button. And some belly button lint. You see my little circle? You see the belly button lint? And we're talking about quadrants. What is it?
That what?
We're talking about quadrants. So what does that mean?
Divided into 4.
We're dividing it into 4.
Yeah, 4 areas. I'll be right back. I'm dying here. It's getting hot in my living room. Okay. So quadrants meaning 4. There we go. 4 quadrants. What's going to be important is knowing which organs, abdominal organs, are in which quadrant. It's very, very important. Because when you have an injury to a particular quadrant, you need to know which organs are there in order to try to determine how severe the injury is going to be. So you need, I am telling you right now, I don't have to look at the exam. I know I check this stuff. And in the future, when you have abdominal injuries, you need to know which organs are in which quadrants, okay? So that picture in your book, that picture in the PowerPoint that you see, you need to the organs. Now the easy thing, and I'm going to show you, kind of, sort of, is let's start out with the liver. Where do we find the liver? So we'll
Left.
call it this
Top right
side.
if it was a patient.
Okay. So the liver kind of goes okay, like that. It's the right quadrant organ, but a little bit goes into the left. Where's the gallbladder?
On the right.
On the right.
Upper right.
Okay. So there's the gallbladder right there. It's a little bit there. Right there. Oh, okay. Where's the stomach?
Left upper quadrant.
There's the stomach. Where's the spleen?
Left upper.
So it's underneath the stomach. Actually, I take that back.
Above.
Yeah. No, it's over. All right, how about the pancreas?
Left upper.
Right upper quadrant. Well, it's left and right. But it's more on the right.
No, the other way
No, on the
around.
left.
It
The left.
starts
It's more
on the right upper quadrant, but primarily it's in the left. Okay. How about the small intestine?
Left lower quadrant.
right upper. And left upper.
Left upper.
Well, it's
There's both right and left.
It's everywhere. It's actually.
Here's the, ready for the small intestine?
It's in all quadrants.
All 4 quadrants. The squiggly line. That's the small intestine. What about the intestine?
What was the last question?
How about the large intestine?
All four?
All four. It starts right here off the small intestine, and then there's the appendix off the large intestine. Then you have what they call the ascending colon because it goes up, then goes across, so they call that transverse colon. Then it goes down, which is the descending colon, and then it curves, and it's the sigmoid colon. And then it goes to the rectum and the anus, and then you get the end result. There's a little. You took the kids to the pool right there. That's the abdominal organs. That is the abdomen. Those are the quadrants. And you notice up here, I put the abbreviations. We were talking about the right, and it was the upper. So RUQ, right upper quadrant. So that's RUQ. What's the left side?
LUQ.
Left up.
LUQ. And what's the lower quadrant?
RLQ.
No, I'm talking about the left.
LRQ.
LL.
LQ.
How about the right?
LLQ.
No, the right.
LRQ.
RUQ. I'm sorry, yeah, you're right. RLQ. Sorry. So those are the abbreviations of the quadrants. Those are the organs of the quadrants. So remember that, because you have blunt force trauma. Actually, not that one. You have blunt force trauma to the right upper quadrant. Which one's going to get injured? What organ was this?
Your liver.
The liver. Any type of blunt force trauma to the right upper quadrant, we have to think about the liver. Any type of blunt force trauma to the left upper quadrant, we got to think about the spleen. The reason being is both of those organs, number one, are solid organs. What does that mean, a solid organ?
A lot of blood runs through them.
There you go. They're very vascular. That's the term we want to remember.
Vascular. All right.
They're very vascular, so they're subject to a lot of bleeding. And then on the flip side, you have hollow organs. What are examples of hollow organs?
Your stomach.
Stomach.
Your bladder.
The bladder.
The small and large intestine.
The
I was about to say
intestines.
that.
So what happens with hollow organs is that they will, if they rupture, they're going to leak out their contents. Urine, stool, food with acid. So that's the danger with hollow organ injuries, whereas solid organ injuries, they're going to be bleeding a lot because of the fact that they are very, very vascular. Okay. Make sense?
Yeah.
Okay. Now, where are the kidneys in all this?
In the back. Posterior. I can't say it.
So they're in the back. They are in the back. They're considered to be retroperitoneal. In other words, they're located in the back. Okay. What else? Any questions on the abdomen, the quadrants, the organs in the abdomen?
No, sir.
Oh, okay. Now, actually, give me a minute. I need to use the potty. All right, I'm back. So, next up, the body systems. Now, with anatomy and physiology, we're giving you guys a broad overview. I do get into the respiratory system and the cardiovascular system probably more than I should. But like I said, I really emphasize those two because I want to make sure you guys are ready for that in National Registry. What I recommend, especially if you're going to advance in your career, become a paramedic, go to nursing school. For nursing school, you're going to have to do it. Paramedic, it depends on which program. But they highly recommend that you take an anatomy and physiology course in college. Okay. There they go more into it. They do dissections and get into it, get into the nitty gritty of the human body and understanding how it works. And that's what anatomy is. Anatomy is the structure of the body, while physiology is the function of the human body. And so we're going to go over the human body, just a broad overview. We're not going to get too in depth, okay? But I will give you information. I will tell you what's important to know as far as how at least those two systems work. And we'll talk about the others, but we'll really concentrate on respiratory and cardiovascular, okay? So the first system we're going to talk about is called the musculoskeletal system. And that deals with the muscles and the bones of the body. And so, I don't have my clicker here. So tell me about the functions of the musculoskeletal system. And I'm going to go here and I'm going to call on Kurt. Tell me about the functions of the musculoskeletal system.
Right, sorry, sir. I couldn't turn on my mic. What was your question?
Tell me about functions of the musculoskeletal system. What's the musculoskeletal system good for?
For the muscles?
Okay.
With the bony framework, skeletal, and held together by ligaments and tendons.
Yeah, how protect the main organs like the lungs, the bones.
Banker, you keep changing your voice on me.
Oh, I'm sorry.
Yeah, the muscles protect the organs. And the skeletal system is used to also to protect the muscles and to be able to move.
Okay. So the first component is musculoskeletal system is responsible for protection. Give me an example where it protects the body.
Well,
so I want you guys to think, because when I ask a question, this happens in every class. When I ask a question, I get what's written right in the book. It tells me you guys can read the book, but it doesn't tell me that you guys have studied or prepared for it.
The muscles are mainly to, like, if we didn't have them, it wouldn't be able to hold any of your bones or main organs or anything like that.
Okay, so the muscles help provide structure, right? Or
Yes.
actually, they provide for movement and structure. Also, they keep the bones in place. Like for example, the ligaments in the knee, they keep the thigh and the leg intact. Otherwise, we would be walking around like a newborn horse, all wobbly and stuff, right? So they do help us with movement. So my question was, we said that the musculoskeletal system is responsible for protection. So give me an example where the musculoskeletal system is protecting the body or a part of the body. If you
The
need a
chest.
hint, just scratch your head.
Oh,
The skull, it protects the skull.
The skull.
The skull protects what?
The brain.
The
brain.
brain.
The brain. How did you guys get that with that hint? I thought that was a hard hint.
I thought you were asking Kerr. That's why.
Well, by now it's like whoever, but sometimes I'll call on people just to see if they're here. Even though they're coming up here, I want to make sure they're listening in. So, all right, yeah. So the skull is an example. The rib cage is another one, protecting the the heart and the lungs. So it provides for protection. It provides for movement, structure. Without the bones, we would be like a blob, like an amoeba. You're just blobbing there like Jabba the Hutt, kind of. Although we're probably going to look like Jabba the Hutt after this zone.
And it also allows you to take harder impacts, no?
Yeah.
I mean, for example, this one time I jumped into a pool and I broke my neck, and I didn't call the ambulance, so I swam myself out. But for like straight an hour, my muscles were just carrying my head, so I didn't lose any nerve damage or anything like that. But the doctor said it was like mainly my muscles that helped me.
Yeah, it will help keep it in line. But later on, we'll talk about spinal injuries and how it affects the spinal cord. Okay. Protection. What else? Miss SB, what else? Miss Esperanza. We're having some technical difficulties, so stand by to stand by. What about you, Robin? What can you tell me? Robin, functions?
Are you still talking about what is it? Crap. I forgot what the word was called, but since we already said that the skull protects the brain, are we still along the same lines?
That what? I'm sorry?
Are we still on like the same subject as far as the skull protecting the brain? What is the
Muscular system.
Yeah. Are you still asking about that? Like,
Yeah, if there's any other functions of the skeletal system.
okay. I just want to say something about the rib cage.
Uh-huh. Go ahead.
All I was gonna say was, I mean, that's another form of like protection of like, can I say it? Your chest cavity and organs? Like,
Yes.
it's pretty much it, I think.
E-
Well, since we're on the, let me see, SP, it protects the spinal cord, yes. Yeah, the spinal cord is a very delicate structure, so definitely the spinal cord or the spinal column protects that spinal cord. The other thing too is though is that it creates blood. It talks about storage, but blood is created in the marrow. So that's another important function about it. Okay, good. All right, so the structures of the musculoskeletal system are first off ligaments and tendons. What do ligaments connect to?
Bone to bone.
Good. Bone to bone. And then what do tendons connect?
Muscles to bone.
Muscle to bone.
Muscle to bone. So the way I usually remember is the Achilles tendon is the tendon that connects the calf muscle to the heel bone. Whereas ligaments, thinking about Ezekiel Elliott and his ACL and MCL, hopefully he'll turn and hurt his ACL. Can you tell I don't like the Cowboys?
Yeah.
Yeah.
But yeah, it's when an athlete injures one of those ligaments, ACLs, for example. Like I said, it's what helps keep the thigh and the leg, the lower leg, intact. It doesn't move around. It keeps it firm. And so when they injure that, then that's when that joint becomes loose. The other types of tissue, or the other structures obviously are the muscles and the bones themselves, and they have connective tissue as well. All right. The basic components of the skeleton. So we talked about the skull. Then we have the spinal column. As B mentioned, it was to protect the spinal cord. We have the thorax or the chest, then the pelvis, and finally the extremities, upper and lower. So different parts of the musculoskeletal system. So you see here, there's the skull, the spinal cord, the spinal column, the upper and lower extremities, the thorax or the chest, and then the pelvis. 1, 2, 3, 4, 5. What was the sixth one? Oh, that's it. So 1, 2, 3, 4. Oops. 4. 1, 2, 3, 4, 5, and 6. Okay. Now, as far as learning the structures of the skeletal system, what you need to know, the bones that you need to know for sure, the skull. I hope you guys are writing this down. The skull, the mandible, which is your jaw. Actually, let me highlight them for you guys. So you have the skull, the mandible, the clavicles right here. It's not written on there. The humerus, we're still on. The scapula in the back, that's your the radius and the ulna. No, ignore that one. I highlighted the ilium and it's like, nope. Excuse me real quick. Alrighty then. So moving on. So the radius and the ulna, right here in the forearm. The femur. Oh, dang it. The femur. The patella. The tibia and the fibula. Tibia and fibula. The pelvis. That's all right in there. And then the cervical, thoracic, and lumbar spines. Cervical, thoracic, and lumbar. Okay. For sure, you're going to need those. Okay. Sound like a plan?
Hold up just a second so I could finish writing them down. All right.
All right. You ready?
Good to go.
All right. So moving on. So here's the skull, different parts of the skull. Later on, as you progress in your education, you'll learn about the different parts of the skull. You have the frontal bone. So think about the front of your head, the frontal bone. The temporal bone right in here. So, you know, when you're rubbing your temples, you're rubbing the temporal bone. And you can see the outline of the temporal bone right in here. You have the parietal bone. I don't know how to explain that one, but it's the other side bone. There's two of them. You have your occipital bone, the occiput, the back of your head. Here's your zygomatic bone, which is your cheekbone, your nasal bone. You have a small nose here. There's the mandible. Here's the TMJ, temporomandibular bone or joint. This is where the ear canal is. You have the maxilla, and you have sinuses in this maxilla, and up here too in the frontal bone, maxilla. Here's a spinal column. Like I said, you got the skull, the cervical spine. The spinal column is broken up into 5 different areas. You have the cervical spine, which means cervical means neck. And there's 7 bones to the neck. Okay, remember that. 7 bones to the neck. The first one is called the atlas. ATLAS, atlas. Whereas the second one is called the axis. So, atlas, that's an L, T and an L, and then the axis. Those are the first 2 bones of the cervical spine, so your neck. From there, you have the thoracic spine. I mentioned to you cervical is 7 bones, right? And then you have the next 12 are called your thoracic spine. That's your back, your mid back or whole back. Now you'll notice there's 12 bones, thoracic bones, right? Anybody know how many pairs of ribs there are?
24.
Okay, there's 24 total ribs. What was that?
12 on each side.
Okay, yeah, 12 on each side, so total 24. So how many sets are there?
Two.
12. There's 12 sets. And how many thoracic vertebrae are there? I think I'm noticing a trend.
12.
There's 12. So guess what?
What?
There's a set of ribs. Thank you. There's a set of ribs for every thoracic vertebrae. So that's how you know it's the thoracic vertebrae, is if it has a set of ribs attached to it. Okay. Now for the thoracic spine, we go down to the lumbar spine. That's your low back. And there's 5 lumbar vertebrae. 1, 2, 3, 4, and 5. The areas most commonly injured are the cervical spine, your neck, and your low back. Mid back, not as much. So, all right, after the lumbar vertebrae, we have the sacrum, which is 3 to 5 segments fused into one. And lastly, we have your coccyx or your tailbone. The coccyx is approximately the size of a postage stamp, and same thing, that's about 4 to 5 segments fused into one. Sounds like somebody's snoring.
Yeah.
Oh man.
Yep.
All right.
Who's snoring?
It's not me. I'm wide awake. You guys can see me on camera, although I can't see you guys on camera. It's like I'm picking different people and nobody's on camera. So I am telling you right now, the human body section is a lot. And as soon as I get into respiratory, you really need to pay attention, because chapter 8 is also, although it's part of the part 3 and 4 exam together. There's a lot of information, and this is building your foundation. All right. Moving on here.
Do you mind if we take our break?
You want to take it early?
Yeah.
Okay.
What time do we come back?
10:15.
Sounds good.
All right. We'll
Yeah.
see you then.
All right.